Colorado has expanded a lawsuit it filed last year against a manufacturer of opioids.
Sitting next to a list of nearly 12,000 people who've died from opioid overdoses in Massachusetts.
Criminal and civil investigations into the opioid manufacturer Purdue Pharma, the Sackler family, have agreed to pay $225 million in a civil.
Since the 1990s, opioid overdoses have become a blazing controversy, leaving a trail of devastation in their wake. Approximately 500,000 people died from opioid overdoses between 1999 and 2019 in the United States alone, and now thousands of people point at Purdue Pharma's wonder drug as the trigger that led to a perilous public health crisis. But is it all as strange and mysterious as it seems? Could a seemingly benevolent pharmaceutical company have caused so many individuals to abuse opioids and suffer consequent overdoses? This is the true story of how Purdue Pharma became a public villain in the 90s, at a time when no one could easily escape the allure of the era's dark side. It was a hot day in the bustling city of New York when a young pharmacist named Dr. Raymond Sackler had a brilliant idea brewing in his mind. He dreamt of creating painkillers that could bring relief and comfort to patients suffering, in hopes of restoring their happiness and dignity. Dr. Sackler was a young American physician, kind and committed to science and innovation, but most importantly to human welfare. Not only was Sackler a visionary in the field of pharmaceuticals, but he was also philanthropic. His generosity extended beyond his business endeavors, as he aimed to support institutions that could make a positive impact on society. Lucky him. At a time when the world was flourishing with new ideas, technology was at its peak, and Sackler made his way into the future. He began working at Purdue Pharma. Imagine the vibrant 1950s in the United States, a time of growth, change, and cultural dynamism. It was the time when the TV industry flourished, and iconic buildings that you see in the movies were under construction. Even middle-class families moved into the suburbs. The clock was ticking. No one knew someday the landscape of pharmaceuticals would change dramatically, forever. 4 decades later, in 1996, Purdue Pharma announced a revolutionary painkiller called OxyContin. OxyContin turned everyone's head as a game-changer in the medical niche. This drug would bring much-needed relief to patients dealing with chronic pain. OxyContin was nothing more than a little pharmaceutical pill. It emerged on the scene, and American patients were promised relief, happiness, and a brand new life. In short, OxyContin was a potent painkiller. It was supposed to alleviate both physical and emotional agony. But behind this innocent promise, an unimaginable tale of addiction, devastation, and tragedy would soon unfold. OxyContin, otherwise known as Oxy, provided sustained pain relief for up to 12 hours. It contained a potent ingredient called oxycodone, which worked wonders for those grappling with debilitating conditions. This substance could fight constant pain. Doctors across the United States believed they had found a modern-day miracle drug, and patients rejoiced at the prospect of resuming their normal activities once more. Dressed in its sleek packaging and soothing allure, Oxy was simply captivating. Its seductive properties seemed irresistible, whispering promises of tranquility. For a fleeting moment, OxyContin offered an escape from the burdensome weight of pain, as American patients experienced a temporary respite from their agony with every pill. However, as the years went by, this once charming painkiller started to show its darker side. Like a malevolent sorcerer, OxyContin's enchanting grip began to tighten around the brains of patients who relied on it for relief. What was once a simple solution to pain had transformed into an addictive substance, weaving an intricate web of self-destruction in every state. You see, OxyContin possessed a seemingly irresistible feature. When crushed or chewed, it released the entire potency of the drug at once, producing an intense euphoria that some individuals found both blissful and addictive. As prescribing practices remained unchecked, more and more people fell into the trap of OxyContin, unknowingly marching towards a fate they hadn't anticipated. Communities around the world bore witness to the devastating consequences of OxyContin's sinister transformation. Families were torn apart, friendships lost, and lives shattered, all in the pursuit of trying to escape the clutches of this seemingly innocent painkiller. Purdue Pharma's reckless marketing and promotion, the greed of manufacturers and overzealous prescribers, the approval of the Food and Drug Administration, FDA, and grand waves of misinformation were soon to blame for a medical negligence crisis. From the 90s to the early 2010s, billions of people took OxyContin as a prescription drug in the United States. If you had taken a walk around the Big Apple, you would have met a joyful 75-year-old lady suffering from chronic pain taking oxy pills, a 20-year-old young man suffering from post-surgical pain taking oxy pills, or even healthy people with minor medical conditions taking oxy pills. OxyContin was a miraculous drug that made patients feel euphoric. And as the opioid crisis became harder to handle at a political and social level, some audacious people started to criticize the immense financial success of Purdue Pharma for its role in fueling the problem. These people were few, but they questioned how OxyContin had gotten so far. To answer this question, let's talk about money. We know that Purdue Pharma aggressively marketed OxyContin. In fact, the company targeted physicians and healthcare providers through tactics that some would later deem unethical. Purdue Pharma went as far as stating that OxyContin was a safe solution for all types of pain. And what's worse, the company's strategy to make its owners wealthy centered around downplaying the drug's potential for abuse, despite evidence suggesting otherwise. What happened to Dr. Sackler's kindness? Where had Dr. Sackler's philanthropy spirit gone? We don't know, but we do know that the company kept on actively promoting the drug's extended-release formula, even though tension was slowly rising. And as OxyContin prescriptions skyrocketed, Purdue Pharma quickly amassed vast profits. In 2001, it is well known that the drug generated over $1 billion in revenue. The company's bloody net worth reached a peak of $16 billion, and such financial success was largely fueled by OxyContin. You can imagine how the financial gains inevitably led to a luxurious lifestyle for the company's owner. However, the propaganda against OxyContin became increasingly worse, but nothing compared to the devastating impacts of the opioid crisis. Communities across the United States grappled with the devastation caused by OxyContin addiction. Purdue Pharma faced intense scrutiny and legal repercussions. Years went by, and concerns about addiction, abuse, and overdose rates began to surface even more than before. Now, hundreds of people joined the small community of friends and families that had earlier complained about the harmful effects of Purdue Pharma's seemingly innocent drug. OxyContin was found to be highly addictive, with users experiencing severe withdrawal symptoms upon discontinuation. Such realization led individuals, states, and even Native American tribes to file an increasing number of lawsuits against Purdue Pharma. Many of these lawsuits openly accused Purdue Pharma of misleading marketing practices, alleging that the company downplayed the addictive nature of OxyContin. As the lawsuits unfolded, Purdue Pharma was pushed to acknowledge some responsibility in the matter. In 2007, the company settled with the U.S. Department of Justice, paying $634.5 million in fines and pleading guilty to misleadingly promoting OxyContin. However, this settlement did not hold the company fully accountable for the extent of its actions. Money could not stop the rageful wave of people affected by the opioid crisis in America from filing hundreds and hundreds of new lawsuits. And as more lawsuits were filed against Purdue Pharma, the company continued to face even more financial obligations. After providing billions of dollars to communities affected by the opioid crisis, Dr. Sackler finally declared his beloved Purdue Pharma bankrupt in September 2019. However, bankruptcy did not make people compassionate. Purdue Pharma continued to face significant opposition from various states and individuals. Millions of Americans believed Dr. Sackler's public shame could not compensate adequately for the damages he had caused. It was too late to stop the rageful wave of friends, families, and states affected by Oxy. Purdue Pharma was found guilty of 3 criminal charges in 2020. Conspiracy, violation of federal anti-kickback laws, and promotion of opioids were some of the charges. These charges stem from the company's deceptive practices to boost sales of its highly addictive painkiller. And what's more, the United States agreed that the company downplayed the risks associated with OxyContin. The news was out. Purdue Pharma's misconduct led to the rise of opioid prescriptions and addiction rates, causing immense harm to people. The guilty verdict on these criminal charges brought justice to those affected by the opioid crisis. And today, the consequences for Purdue Pharma could be severe. The guilty verdict carries hefty financial penalties, with the company expected to pay billions of dollars in restitution and fines. This will have an impact on Purdue Pharma's workers, who potentially face jail time. In response to the charges, Dr. Sackler acknowledged its wrongdoing and expressed remorse. His company has currently stated its commitment to helping address the opioid crisis, vowing to transform it into an entity focused on providing alternative pain management solutions. While the path to redemption is long and arduous, Purdue Pharma's efforts in rebuilding trust have not gone unnoticed. Many stakeholders, including medical professionals, advocacy groups, and government bodies, have acknowledged the company's sincere commitment. However, skepticism remains prevalent, and many critics emphasize the importance of providing substantial resources for addiction treatment, prevention programs, and support to the affected communities. They think it best to leave Purdue Pharma behind, forever. In 2024, Dr. Sackler's company stands as an example of an organization determined to learn from its devastating history. The pharmaceutical industry must make sure that patient ethical practices remain the priority for stakeholders. Purdue Pharma found guilty should not only hold the company accountable for its actions, but also question the role of pharmaceutical companies in public health. Fighting the challenges posed by the opioid crisis should be a priority. Dr. Sackler's dangerous approach to healthcare serves as a reminder of the consequences that unchecked corporate greed can have on society. This is what happened to Purdue Pharma's seemingly innocent aims to help patients.